All right, thanks for being here, and we are here to advise you that Hamilton has its first official case of COVID-19 confirmed by public health officials late yesterday afternoon, so not related to the case that was identified yesterday, the Burlington resident. It's a 52-year-old male returning from New York City on March the 5th, showed symptoms and was subsequently tested and confirmed. They are in the early stages of investigating this, and I'll let Dr. Bart talk about that particular case in a moment. As we identified yesterday, the city has put into effect its Emergency Operations Center, which will be meeting daily or as required, but daily for sure, on a level 1 incident management response. This is when there is a formalized planning around an event that is going to potentially impact city services or a reduction in the services in our community. So the purpose of the activation is to ensure that city services in response to COVID-19 can be continued and operations within the city resumed. And public health will be leading and coordinating the broader community response from a public health perspective. With me is Dr. Bart, who will go over, Dr. Bart Harvey, who will go over the Associate Medical Officer of Health, who will go over the current COVID case that was identified yesterday.
Thank you, Mr. Mayor. As the Mayor has alluded to, this individual identified themselves as being symptomatic. They had traveled recently from New York City. As soon as they had identified themselves, our staff coordinated them to be able to get to the urgent care center at Hamilton Health Science Center, where he was tested, then stayed in self-isolation until the test result was available, which is normal practice. And then, as the Mayor has alluded to, yesterday afternoon, the provincial public health lab alerted us that the test result had been positive. Our staff are in the midst of working with this individual to determine what their movements were and to identify any individuals that will be asked to go into self-isolation because they would have had a contact with this individual that could be consistent with the ability to transmit the virus. Maybe I'll stop there. And
what time yesterday afternoon did you find this out?
My understanding was it was mid-afternoon, later afternoon.
Do you know why that wasn't reported to the media and the public right away?
Well, there's a process that needs to go through with the ministry to coordinate all of this and to verify things. So this isn't kind of instant reporting, but rather the ministry, as I understand it now, is kind of and will continue to be the provincial coordinator of this. We're the Hamilton node, but we're part of a provincial and in fact a global network working together to try to combat this virus. So my understanding is the ministry does regular postings of their announcements at they're now doing it twice a day, 5:30 p.m., 10:30 a.m. This announcement didn't get to the 5:30 one, it got to the 10:30 this morning, and that would coordinate with the public announcement.
How concerned should Hamiltonians be that we're seeing and these cases continue to occur? What are the escalating levels of containment that the city is prepared to take?
Well, I think the containment efforts that we continue to undertake are the containment efforts that we've been doing for the last couple of months. I would say that at the present time, the risk of an average Hamiltonian being infected with this virus remains low. We certainly remain on vigilance. One of our key strategies around containment is being able to identify anybody who has been infected by this virus as quickly as possible so that we can try to contain it. Have that person isolated, identify who that person might have been in contact, have them self-isolated to try to certainly reduce, if not ideally, eliminate the risk that they might be able to transmit the virus to others.
Are we looking at closing schools? Or is that on the horizon? People are starting to wonder, at what extent? Are we closing shows coming up this weekend? People are wondering how to plan their lives.
Well, I think some people are already doing that voluntarily, and that's reasonable. At this point, essentially what you're referring to is what we would call social distancing. People would identify that as being kind of past the containment stage, where we have good evidence that the virus is freely communicating in the community like influenza does every year. We're not there yet. There are some communities that are. Certainly Washington State is there. We're not. I can't guarantee we won't get there because this virus can be it's a creative little beast.
So what would be the sign? How do you know that we've made it that way?
Oh, I think when we get free community spread. BC's announcement that they have cases where they're not sure where the individual contracted the virus. We're pretty sure that we know with this individual, he attended meetings in New York. He was contacted by a colleague who was at the same meeting who's in Boston to say, I became sick, I got tested, and alerted all of his business colleagues that were at the same meeting, including this individual. And that was his tip-off to be extra vigilant that he had been in contact with or had been in the environs of somebody. So that wouldn't be consistent. That would be an imported case.
So the distinction is the travel case as opposed to...
Yeah, or certainly if we had a positive case. So this man's family members certainly were in close contact with him. They'll be in self-isolation and have been ever since he became symptomatic and was being tested. And so if one of them, that would be close contact. We would know where their contact was. If somebody becomes symptomatic and goes to one of the assessment and testing sites and tests positive, and in talking to them, no travel, no contact. I mean, we would work as quick as diligently as we could to identify where they came in contact with the virus. But it'd be similar. I mean, the people that test positive for influenza every year, if you ask them where did they get it, the vast majority would say, have no idea. That's the example of kind of free transmission in the community.
Dr. Hart, two questions.
Yeah, Ted.
How many public health staff now have been redeployed to this coronavirus effort? I think I can't remember what the number was before, but has that, can you give me
So you'd probably know it better than I do. Certainly our infectious disease team has always been on this. We did an initial redeployment. I was at a meeting over at the Jervinsky with Dr. Richardson. She made the comment, I think we have an additional 57 staff on top of our usual staff.
I see, okay. And for example, I just read this morning that Burlington, for example, has created this, I don't know if this is akin to what we're doing, has created this rapid response team. And they're also going out and disinfecting what they're calling high traffic touch areas or something. I don't know what they're calling it. Is that something that we're doing or thinking about doing?
So again, this is a respiratory virus. They're all unique because they all have unique genetic profiles. But quite frankly, on an annual basis, we have a respiratory virus that visits us regularly. I would argue that the usual cleaning processes that we undertake to decrease the risk of transmission of influenza are exactly the same. As far as surfaces, cleaning surfaces regularly with bleach, hydrogen peroxide, alcohol will do that. I don't know, and when you mentioned Burlington, you're mentioning a municipality. For me, the public health unit would be Halton. So that may be the municipality has undertaken that.
So let me answer that.
yeah.
So EOC is looking at all of those issues currently. There is the emergency operating center. They're exactly what you think they are, which is a task force coming together, senior leadership team, police, fire, paramedics, all sitting at the table talking about what next steps do we need to do to contain this and protect the public and protect city staff and maintain services.
And I think some trips have been canceled. I learned about the Italy-Spain trip, I think was canceled already. Is there anything else, any other international travel?
Not as yet, but that issue is being looked at, and decisions are going to be made in the next 24 hours or so. Cleanliness is an ongoing issue. We have regular cleaning that happens here all the time. I think we'll add more sanitizers at doorways and gateways in all of our facilities, and staff will later on probably come forward with some decisions as to what next steps would be, and we want to make sure it's a measured response. So, right now we have essentially one Hamilton case and one Burlington case that has impact in Hamilton. As things ramp up, obviously the decision making also has to ramp up. And in terms of redeploying services, we'll be sending a message out later to council and staff that there are going to be a number of senior leadership team members occupied with this issue probably for some time. We can expect more incidents to happen, and the anticipation of other things falling off the shelf is probably going to happen because this will be a higher priority issue, and some things that they might have been working on normally might be set aside for a while.
I have another question though.
Yep.
What meeting was the doctor
I don't know, I just know it was a work-related meeting that he was
Tell us a
attending.
little bit more about what he did for a living.
Come on over here.
I'm not sure that I know that. And I know that our staff is talking to him and trying to determine, so one of the questions would be interactions in his workplace and whether he kind of was there, and if he was, who he interacted with, and identifying people that might be at high risk of having had the virus transmitted to them, and they'll be reached out to and asked about symptoms. And even if they're asymptomatic, then we'll ask them to go into self-isolation for a 14-day period after the last time they had contact with him.
How many family members are in self-isolation or anything?
I think there is a son who I don't think he would describe himself as a child. I think he's a late teenager and a spouse.
Is it concerning that these last two local cases are people who traveled from the United States?
To me, it's not concerning. I think it's evident that, again, we know that Washington State, there's already been documented free transmission of the virus. I think the United States, if you watch any of their networks, I think coronavirus is probably taking up half of their airspace, so they very much, they have the vice president that's kind of been allocated to lead this. So I think the U.S., I know that our health science colleagues in the city, since late last week, if somebody has symptoms and they have international travel anywhere, then they're testing them. And again, I think that's part of containment is we need to, err on the side of over-testing so that we don't miss anybody and allow them to have extra time to circulate with other people and potentially transmit the virus.
Is there any difficulty in Canadians getting tested or any roadblocks? Is there not testing? We hear about shortages in the U.S.
We hear about what?
We hear about shortages in the U.S. and people not being able to access testing. I'm just wondering if that's the case here.
Well, I think the last comparison I saw, I think Ontario's done more COVID ID tests than the whole of the United States. So I think they do have challenges, and I think they're addressing those. I don't have to worry about that jurisdiction. I worry about this jurisdiction. If you talk to some of our colleagues in the assessment and testing sites, they're feeling the crunch. There's a lot of people, and that number is increasing. I think the recognition of the case earlier this week that certainly, as the mayor has alluded to, have connections to Hamilton, kind of put Hamiltonians understandably in, and then this case as well. So COVID ID, I can no longer say to you folks when I talk to you, if a case comes to Hamilton, now a case has come to two cases, I would agree with the mayor. I think the first case is a resident of Halton, certainly they play a significant role in Hamilton, so we would rightfully see that as being a Hamilton-related case. And so we'll continue to be vigilant, want people to get tested. Numbers are increasing. We do want to reiterate, so using this opportunity, the only people who need to be considered for testing for COVID-19 are people who are symptomatic. So I think that part of the challenge is people are understandably worried, but if people are well and don't have symptoms, they will not be tested. We just don't have that many test kits to go around. And
Can you specifically describe those symptoms that people should be looking for then? Because I think there's confusion with that.
well, I think it would be your classic symptoms of an upper respiratory. So you have fever, but some people haven't mounted a fever. But definitely you have a cough, you might have shortness of breath, you're feeling unwell. Somebody who is feeling well but is worried and therefore wants to get themselves tested just to they're not going to get tested. They're slowing down the system in the urgent care centers and the other assessment and testing centers. So if you're asymptomatic, you don't need to come forward. By all means, if you are symptomatic, and especially if you've had international travel, call telehealth, call the health unit, call their family doctor, and let them know that, and then we can facilitate determining with them whether in fact it does make sense for them to get tested, and then facilitating them to be able to get there in as safe a fashion as possible, so that again, if they are infected, we reduce the risk that they're going to infect somebody else.
Okay, public health is, you might want to talk about that, looking at safe assessment sites as we go forward. Not defined as yet, but something that is on the horizon, I believe.
Do you know why we didn't get one today? There were some announced today and Hamilton did not
Get what?
get one of those assessment sites. There
So-
were assessment sites announced today by the province and Hamilton was not on them.
Well, so the province right now is broken into 5 regions. So we're part of Ontario West, which goes from about here to the Michigan border. So that group is in the midst of, I was part of a 2.5-hour teleconference earlier this morning that started at 7:30. So it was multiple partners across Hamilton talking about the feasibility and ability. So those proposals will go to the what's now called the Ontario Health West. And they will be looked at there, and they'll be rolled out from there. So we're not rolling them out independently.
How fast will that
I don't know. That's at a provincial level.
And-
I work at a municipal level.
As needed, I'd imagine. So
Yeah.
as things ramp up, that it's going to be a heightened concern to make sure that testing is done away from hospitals and away from anyone that might be impacted by it. So
Well, and-
as needed, it'll ramp up.
Yeah, and in fairness, our hospital colleagues have already the ability to move out of the emergency rooms into their urgent care centers. I would anticipate that in the next few days we will have additional assessment, and they really are assessment centers. They're not just testing, because if somebody's symptomatic, quite frankly, influenza A or influenza B is probably a more likely reason that they're ill. And in fact, many of the people that have been tested for COVID-19 have tested negative for that, but tested positive for influenza. So they need to be assessed and appropriately tested.
There is a hotline and website where people can get all the information that's available right now. It's identified at the front of the podium here. Encourage people that have worries or concerns. They can go to those sites or call the hotline and get all the information they need to make them aware of what symptoms are and whether or not they should be getting a test done.
And people are calling, and that's why we're deploying a lot of extra staff, is to man those phones.
You didn't quite finish your sentence. You said, I would anticipate in the next few days to have additional
Oh,
assessment
the assessment sites.
sites?
Yeah, assessment and testing sites. Yeah, absolutely.
Just quickly on I'm recognizing it's a Halton case, but there was a third HHS doctor who was traveling and that they were trying to get a hold of yesterday. Do you have any update on that?
Yeah, so I think we certainly have locators on that individual. I believe that our staff has spoken to them, alerted them of the situation, and certainly made them aware that they should be extra vigilant about potentially developing symptoms. I'm not sure when they're returning from their travels. Certainly if they become symptomatic, then wherever they are, they will seek assessment and testing and go from there.
So she's not in self-isolation?
I don't think I mentioned a gender, did I, Mr. Mayor?
Yesterday.
Okay, good. So she's being counseled to, so the challenge is when you're out and internationally traveling, when you're at home, self-isolation is a relatively straightforward thing to do. I think, she'll be made aware. I mean, she's a healthcare practitioner, so she'll use appropriate diligence. The reality is she and her traveling mates are going to have to, at some point, make their way home. Maybe it's an extended vacation and they'll be out of the 14-day window and it won't even matter as long as she stays asymptomatic.
Where is she?
I don't know. Somewhere exotic, I hope.
How many contacts do you now have with this new case?
I don't know that. We're still in the midst of, so all of that machinery kind of kicks into gear once we know I have a positive test. So it's reaching out, and then it's reaching out again. So we're in the midst of that.
Do you know yet how many people were within? So yesterday at the press conference was the patients. They said they were also looking to find out the people who went with them to the appointments. Do you have a number on that yet?
I don't. And in fact, I think that number's been modified, that there were 14 patients booked to see that doctor. I think a total of 11 of them attended. So the 3 that missed their appointment.
Dr. Harvey, one thing, I think you have a meeting next week with some of the homeless service sector people. Can you tell us when that meeting is and what sort of ideas or plans you might have?
With who, sorry, tell you?
People like social service agencies.
So I'm not sure if I have that personally, or, and to tell you the truth, if I do, I'll find it in my calendar when I get to it, but...
Is there any plan for shelters? I know Toronto.
Oh,
a couple
I
of
think,
days ago.
yeah, no, absolutely. I mean, right from the get-go is identifying, who are the populations that are particularly vulnerable, and, our Hamiltonians that where housing is a challenge, living in shelter systems, et cetera. Several of my colleagues across the city, especially in Toronto, have flagged that, if this virus gets kind of in there, this is because we know that, people who are vulnerable, older, chronic conditions, et cetera. As far as the complications, similar to influenza, these are the folks that when they get the virus, they have a difficult time fighting it off, and they suffer many of the complications, one of which is death.
Right.
Yeah.
So that's a shelter component. What about people who end up being pulled up? Let's say that happens for quarantine 2 weeks. Let's say they don't have a big income and maybe they're not working as a result of getting paid and they're running out of food. Is there an OW program for that or something?
So we're certainly, and I believe the EOC is also, because that's where we can tap into housing resources and other resources. Certainly we've recognized, I'm going to use self-isolation rather than the Q word if I can, Tevye. But we recognize that people that don't have family members that could go out, make sure they have groceries, et cetera. So part of when our staff are reaching out to people that are being self-isolated, we're taking into account what their circumstances are, what their abilities are, and then being able to provide whatever assistance that's necessary so that they can hold up for that up to 14 days.
So do you know how many people in Hamilton are self-isolating?
We'd certainly have this case, we'd have the ones that were related to the earlier case, and then because there are now 3 regions in the world that are identified as particular hotspots. The original province of Hubei in China, Iran became more recent, and now Italy most recent. So the advice to individuals who are returning from any of those areas are that they should self-isolate for 14 days after leaving those areas and report to local public health. The last count I had, I think we have 6 such individuals. And then anybody who's become aware that they were in contact with somebody who has tested positive, we would also want to self-isolate those. The most recent numbers that I saw, which probably is at least a day ago or a day and a half ago, we had about half a dozen of those folks that we were monitoring.
And you're monitoring?
Yeah, it's public health monitored self-isolation.
Okay, and as per usual, there's information access points on the screen here, and wash hands, don't touch your face, clean phones and keyboards and things that you use often is a great way to curtail this potential spread. And let's look after one another. There are seniors that are particularly vulnerable, so if you're looking after aging parents, make sure you advise them on what they should and should not do, and public health will be making recommendations as to what needs to happen going forward from heretofore. So as things evolve, we will continue to share information with you all. Thank you all very much.
Thank you.